And so I'm delighted to introduce Dr. Dominic King, who's the clinical lead for DeepMind, our hosts for today. And Dominic is going to be talking about transforming health with digital solutions. Dominic.
Thank you so much. Fantastic start, Julie. Thanks so much for that. So first of all, it's a huge honor for us to welcome a community of people that are doing so much to improve patient outcomes and quality of life. So thanks very much for taking the time to attend. I think to start off with, digital technologies have completely transformed just in the last few years with smartphones and tablets, the way we work, the way we shop, the way we bank, the way we travel. Although some of those advances I don't think we've seen so much in healthcare. So it's estimated that about 50% of banking now takes place on mobile. Yet the last estimate I saw of digital interaction with the NHS was about 2% of patients claiming to have any meaningful interaction. Just as an indication of the way the world's going, I encourage you not to spend Saturday like I did at IKEA a couple of weeks ago. But you know, about 80% of people plus, I think it's probably more than that now, sleep with their smartphone next to them and probably check it at different weird times of the night. First thing in the morning, it's the first thing you do. And now chargers are being put into the bedside table. So the world is just changing in ways that I think we didn't think was possible a few years ago. I just wanted to start off just telling you a little bit about DeepMind and the work we're doing in health before giving you some insights from my experience prior to DeepMind, where I led the digital health program at Imperial, and also some of the kind of insights we have here from working on the products that we are. So DeepMind is entirely based here in King's Cross. It's an amazing organization. I've been here for about nine or 10 months. We have 300 or 400 of the world's leading experts in artificial intelligence and machine learning. We effectively operate like a very successful research organization. We publish hundreds of papers. We have this real long-term focus on solving big challenges, but we're backed by the huge resources that we have here, which is incredibly helpful for the kind of mission that we're trying to accomplish. And this is all, again, also backed up by a real kind of ethos that runs through the company of trying to use the technologies that we're developing for good. A rather grand mission statement that DeepMind has is to solve intelligence and use it to make the world a better place. And we broadly split our work into two different things. First, research, building algorithms that are capable of learning from raw data, and then these algorithms are able to operate across a wide variety of areas, and then using these algorithms to help us tackle some of society's toughest social problems. In the last 18 months, we've published for the academics and scientists in the room 3 Nature papers, including 2 Nature front covers, which is a really amazing achievement for our research team. And we've also started to see real progress in applying these algorithms to real-world problems. So a few months back, we announced a project where effectively the internet is supported and running by massive Google data centers around the world. One of the big things that those data centers have to do is cool the massive amounts of heat that's generated from all the servers. Huge costs, huge environmental impact. And using DeepMind algorithms in a trial that took place last year, we were able to reduce costs from cooling by 40% by applying our algorithms. And this is now being scaled up across Google infrastructure and also looking at how we can apply this more widely. So in February of last year, we announced the launch of DeepMind Health, which is our first kind of external-facing applied group. I and many others are struck by real pressing challenges we have in healthcare. So the fact that a substantial proportion of care we deliver is not evidence-based. There's massive variation across the NHS and other health systems in the way we deliver care. And this persistent problem of patients being harmed in hospital and having poor experience from the care they receive. We're fundamentally working on trying to at first help digitalize healthcare in a way that we think can have really positive impacts on both clinical outcomes and patient experience, with an initial focus on clinician-facing solutions, but a real goal to be working very soon on patient-facing applications. So this is Sarah, one of my PhD students and a surgical registrar at Imperial. This is very much like when I graduated from medical. This was taken a few months ago and is very much, or not dissimilar to when I graduated from medical school 13 or 14 years ago. Persistence of pages, paperless, make it actually really difficult to deliver good care. And so we're working on moving from pages and paper to mobile-first, clinical-led digital solutions. And just to give you a sense of the kind of thing we're building, when Sarah and her colleagues go to see a patient, they are able to access all the relevant information that they need to look after that patient. So does the patient have allergies? Previous diagnosis? What are the latest set of observations? Which clinical team members are looking after the patient? What patient alerts have been generated? What's the imaging looking like? This currently takes many minutes to log into different systems to access this information. The ability to potentially consultants, etc., to be able to keep a much closer eye on their patients through remote monitoring and visualization of observations and tests coming through. If it's frustrating for doctors and nurses to deliver care with the current state of technology in NHS, I very much recognize it's immensely frustrating for patients too. I've been lucky to be healthy through my life, but we had a premature son born last year, and so I have for the first time had to look at healthcare with from the other side of the table. And booking appointments, changing medications, etc., are just so different from the role, how things work in other domains and sectors now with the benefits of all the technology we have. So we've talked about this for many years, but we would love to see a world in which you're able to see what appointments you have coming up, communicate with your clinicians more effectively, look at results, and take a much greater part in shared decision making. Now, enough about DeepMind, because this is about you guys. You can find out about all our projects. We publish absolutely everything on our website. There's huge amounts of information about the team working on all these projects and about the partnerships we've signed with NHS trusts and other organizations. So just to run through a couple of insights on digital health from kind of our experience and what we've gleaned from working with existing partners. So a key thing to begin with is enabling technologies need to be in place. I'm not going to ask for a show of hands, but I'd be very surprised if there is anyone here that does not have a smartphone. Amongst clinicians, these are ubiquitous devices. In a survey that we published, this is 2015, using late 2014 data, 99.8% of doctors across 5 different hospitals had a smartphone. I've never met the handful that don't. 98% of nurses, the vast majority of these staff are already using their smartphones to help them with work. We're at probably 85% of the UK population, one of the highest penetrance rates in the whole of the world having access to smartphones, and prediction on 100% penetrance is surely within the next kind of year or two. As Julie talked about from the Parkinson's perspective, there are amazing ideas out there, and it's incumbent on all of us to kind of draw on those ideas. Just to give you a sense of that, back at St Mary's a couple of years ago, we put a couple of posters up in the lifts and said, do any doctors, nurses or patients have ideas for apps that could help them deliver care or to access care better? And we had 80 applications, which were the level of ingenuity and potential in those applications was extraordinary. So this was a group of doctors who said, we want to share clinical images with each other, which was supported. There's a lot of people hacking around, and I don't mean hacking as in doing anything illegal, effectively cobbling together solutions to make life better for them. So clinicians, for those of you that don't know, are very wide users of WhatsApp to communicate with each other because they realize the problems of using pages and telephones. And there's people in the audience like Paul who have built platforms for patients that really are making a huge impact already. There's a fundamental principle in how we build products here that we should be putting the user at the very center of what we do. So when we build a product, we spend huge amounts of time with the end user of that product, asking them what the problems they face are and how we can work together on generating a solution. So this is Sarah, one of the senior nurses at the Royal Free Hospital, who has basically spent months providing her expertise and insight into what a technology solution that would suit her needs looks like. I'll just run a quick video of one of her colleagues, Mary's perspective on this.
What's nice about helping to design something is that we have a say in how it will be useful. What I've seen about the design of the app is that the screen is clean and it makes sense and there isn't too much information on it. It's not all in your face. Technology should support your work, should support what's going on with that patient. So if you can communicate that easily to people, it's going to save time.
As we have started thinking about what we can do for more direct-facing applications for patients, we completely see the importance of doing exactly the same approach to the clinician-facing platforms as we would with patients. So we ran our first patient event here a few months ago, which a number of people in the audience attended, where 150 people joined us, and dozens of patients have offered their help and support in our efforts, and I'm sure that you guys would generate an even bigger response from the groups you look after. I think it's really important that for those of you that already have, I mean, I've supported about half a dozen digital health projects for charities. It's really important that you take as robust an approach to this as you would in any other area of product development. We did what's called a systematic review last year of all the applications that exist across the whole sphere of surgery to look at the quality of them, of the products or the apps that existed out there, and it's really dismal. Less than 10% follow any type of evidence base, less than 10% have any involvement of clinicians and patients, and I think it's incumbent on the people in this room to do a bit better when you think about digital health. And there's lots of support out there online in terms of protocols and plans for how you can really introduce an evidence-based and QI approach to the development of your digital tools. It's also really, you're going to hear from an old colleague of mine, Lenny, from the Helix Centre later. It's really important on this design aspects that people really expect products that are going to delight them. They're not up for saying, oh, well, it's a charity or a hospital is providing an app. They really want things that look and work as well as anything else they use. So I hope I'm not stealing Lenny's slides here. This is from some work at Helix. This is, I know there's people from asthma charities here. This is the kind of state of some asthma apps on the app market now, and I think we'd all agree that they don't look very good. And then good design and bringing patients into the design process leads to things that people will actually want to use. So this is an app that the guys at Helix have been working on to try and engage children in managing their asthma better. There is a dearth of evidence around digital health, and again, it's important for people who are investing money and building digital products to really measure the impact. And I just want to give you an example of a study we did at Imperial and the Department of Health and Cabinet Office last year to show what impact digital interventions can have and what the follow-on from that can be. So, as you know, unfortunately, about 20% of patients miss hospital appointments in London, probably about 15% in the UK. And we just did a relatively simple study, RCT type design, where we sent different types of messages to people to remind them to come to their appointment. 4 different messages. A control message, which basically says turn up to St. Mary's on September the 16th at 10 a.m. to cancel or rearrange, call the number on your appointment letter. This message was being sent 6 million times a month across the NHS, and it's clearly a ridiculous message that you should look on your appointment letter. 3 further messages around putting the phone number on, telling people a social norms message, around 9 out of 10 patients attend, and then telling people the cost of a missed appointment, which took a lot of time to agree what that cost was with the Department of Health. But the impact of this was that we reduced DNA rates by 30% based on that cost message, which we estimated would lead to 300,000 less missed appointments every year. Now, this was only possible by doing a study. When you asked all the behavioural experts around the table what they thought the most effective message was going to be, everyone said norms. And the follow-on from that is that that message is now being sent hundreds of thousands of times a month by different trusts, and is now a kind of policy that should be being used. So it's only by a rigorous study that we're able to actually, I think, deliver very big impact. And then just to close, although that's not to discount the importance of this, I think this is like so critically important. Data security, public permissions, privacy. None of you want to be in a position where you threaten, for us it would be an absolute catastrophe if we were in a situation where patient data was compromised. This is, headlines every week about ransomware and data being misused across the NHS. There was a report last year from some colleagues at Imperial that looked at the safety and quality of, I think it was 120 apps on the NHS approved store at the time. That's now no longer functioning, I believe. The vast majority, if I remember, over 90% had major issues and problems. And so for you guys thinking about developing an app that is going to be branded by your charities, you need to take this stuff super seriously, because the consequences of not taking it super seriously could be really significant. And on that in that area, we have lots of expertise. So if you have any questions about any of the areas I've covered, and particularly, for example, around security, and getting some advice from us, we'd be very happy to help with anything that you guys are doing. So my email address is up there, dominicking@google.com. Loads of information on our website, and we'd be really happy to speak to any of you and host any of you in these offices to find out more about what we're doing and how we can help. Thanks very much.
Thank you very much.
Thank you.
Your questions for Dominic and Julie. As many of you will know, up until the end of the year, I was Deputy Chair of NHS Digital, and spent my 4 years there really trying to get the organisation to focus rigorously on how we build patient and public trust in the NHS's protection and privacy and confidentiality of the data we hold on their behalf. And there is still a long way to go in that. So your final remarks, absolutely crucial about how do we in the charity space ensure that we are properly protecting and make sure that we are as protected from cyber attack as we can be. And that's not a cheap thing to do. But you really need to remember that the value of health data is now greater than the value of, say, credit card numbers. So in the dark web, the sale of health data, particularly in the United States, has a higher price than credit card data does. I just leave that with you to think about.